As you can tell, it's a busy day here on 2 News at Noon. In fact, our friends here from Intermountain Healthcare will be taking your questions through our 6 o'clock news today. There's the number on your screen, 877-908-0680. We're talking about breast cancer today. And joining me now is special guest Dr. Rob Ferguson. He's from the Intermountain Plastic Surgery Center at Intermountain Medical Center. Appreciate you being with us. So let's talk about reconstructive surgery. I guess there have been a lot of advances over the last maybe 10, 15 years.
There have been. There have been advances in techniques and advances in devices. Most of those techniques are able to, we're able to start those at the time of mastectomy, and then our techniques have advanced such that we are providing less injury to the patient in the process of reconstructing the breast following a mastectomy.
And I guess it's pretty invasive surgery, isn't it?
Some of them can be minimally invasive and some are a bit more invasive. But even with those invasive techniques, we've done things that have begun to spare, for example, muscle that used to be taken in previous reconstruction techniques.
Now, who would be the best candidates for that? Not everyone who has to go through this is necessarily a candidate for reconstructive surgery.
That's true, but surprisingly, most of the patients who undergo a mastectomy are good candidates for reconstruction. So a patient who is told that they would require a mastectomy, I would recommend that they speak with a plastic surgeon to find out if they are a candidate, what type of reconstruction they'd be a candidate for, and the timing of that reconstruction.
Okay. Now, as far as those going through preventive procedures, a lot of those folks or women are good candidates too, right?
That's correct. And most every woman who has, for example, a BRCA mutation, who has a prophylactic mastectomy, does want to have a reconstruction and is also a good candidate for reconstruction.
Okay, and this does a lot more than the physical aspect of it. I mean, this is really emotionally helpful to those who have suffered through breast cancer, which is just a horrible thing to go through.
It is, and in fact, I quote one of my patients all the time. She said, "I know it's not part of my cure, but for me it's part of my healing."
Sure.
I thought that was a great way to term it, that for most women it is part of their healing process.
Okay, and for more information on this aspect of it, reconstruction, where can people go for more information?
They can go to Intermountain Plastic Surgery Center's website, or they can talk with their surgeon to be referred to a plastic surgeon.
Okay, well, doctor, thanks so much for being with us.